things stop shaking. Okay, so I want to talk a little bit about diagnostic facet injections. We get a lot of questions about this recently. When we look at the image and when we examine the individual, there could be multiple generators in the spine that can contribute to the pain. So we're going to take a second to talk a little bit about the facet joint. The facet joint, any place you have a joint, there's two bones that come together. And in this case, that's going to be right here. And it's between the superior articulating process of one lamina and the inferior articulating process of the other. And that's where these two bones come together, and that's where you typically bend, twist, move, and you have some cushioning there called synovial fluid. But over time, when maybe your disc height starts to decrease, if the disc heights decrease, that's going to bring these bones together, and then by translation, bring these facet joints together. When they start to rub, that can create some of that lower, deep, nagging pain that you have in the lower part of your spine. And so what we do is called a diagnostic block. Maybe you can make the analogy of when you go to see your dentist and they numb up that one specific nerve which gives you dead jaw. So similarly, I would place a small needle onto the groove where that dorsal median branch comes off, and that nerve is responsible for sending pain information from the spine to the brain when that joint gets pinched. And so if I can block that nerve and provide you with 4 hours of pain relief, which should equal the duration of that local anesthetic, we then know that we've found the correct target. We can then come back with a specialized needle tip where we heat up the needle tip. It's like cutting the telephone wire and preventing that pain signal from ever reaching the brain. Now that pain relief should last about 9 months, 6 to 12 months, just depending on how quickly your nerves regrow. We're not fully killing the nerve, we're just stripping the insulation so that it's not going to conduct that electricity as quickly, so to speak. That's sort of your pain-free window, your holiday, to get into a good physical therapy program, work on your core muscle strengthening and your flexibility so that when these nerves regrow, the spine is more stable, the joints aren't rubbing as much on each other as they were before, and voila, you're pain-free. Back to doing what you love.